Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. All right, well, welcome back. And this week I have Dr. Janice Miller of Audiology Plus, who's a doctor of audiology. Janice, thank you for joining us.
Thank you for having me.
And if you could just give us a little introduction on yourself and what you do.
Okay, well, I'm a doctor of audiology, as you just said. I've been an audiologist for many, many years. I won't give my age away, but I've seen a lot of changes in the field. I'm here in San Antonio. I've got 2 locations. One is west of downtown on Guadalupe Street. It's 1313 Guadalupe Street. The other location is 281 in Bitters, so it's 13416 San Pedro Avenue. And I am here to help diagnose hearing loss and fit hearing aids.
Great. So what can you tell us about kind of what we've learned about hearing loss over like maybe the last 10 years or so? How common is it?
It's very common, and a lot of people are delaying getting a diagnosis of hearing loss. They may have had problems many years before they get a final diagnosis, but I find that, or studies have shown that people may have hearing problems as long as 5 years before they get a diagnosis. And then if they need hearing aids, it may take them an additional 7 to 10 years to get the actual hearing aids.
Yeah, a lot more common than I think people really understand, mainly because we kind of have this stigma that older age and hearing loss, and it's a normal thing, just you can go through it and we'll learn to deal with it. But actually, correct me if I'm wrong, we've seen a huge number of individuals with significant hearing problems much, much younger in age.
That's true. That's true.
Why do you think we've been seeing that?
I suspect just the noise exposure in the environment, music, listening to loud music, just being around construction, just overall exposure to noise, in addition to the aging process and having hearing loss as we age.
Sure. So what are some things that, to those out there listening, what are some warning signs that, maybe I am having some hearing loss. Maybe I do need to get my hearing checked.
Okay. Some of the warning signs might include that you're asking others to repeat quite often. Others are complaining that the TV is too loud. Might be another sign. You're having difficulty following conversation when there's more than 2 speakers at a time. Difficulty on the phone. Those are some of the warning signs. Ringing in the ears. That's also a warning sign.
And that's a big one that I've seen for a lot of my patients, where eventually we did get them, thankfully connected with an audiologist, and hopefully you're doing much better with hearing aids. But that ringing in the ears, especially in a really quiet room or at night, I get a lot of tinnitus or that ringing, and I can't sleep, or once the lights go off, I'm trying to go to sleep. It's kind of annoying sound, and we all think, there's an infection, there's something wrong with my ear, but we have to kind of realize that can be that early signing of
exactly. It could be
loss.
A warning sign of hearing loss. And with tinnitus, during the day it may be less bothersome, but late at night, when you've got nothing, no other competition for that ringing, you may notice it more.
Yeah.
I tell people probably have an app on your phone with some other sounds, like a fireplace, a wood-burning fireplace, or rainfall, raindrops.
I can usually recommend either some white noise or even a fan, just something making a little bit of background noise in the back can do a lot for tinnitus.
Exactly.
And of course, the other way to help with tinnitus is the same way that we help the hearing loss, is hearing aids.
Yes, hearing aids will help with tinnitus in terms of amplifying other sounds to mask over that tinnitus. I also have some noise generator type devices where I can present noise along the lines of ocean waves or running brook, which is much more calming than the annoying ringing that people hear throughout the day.
Yeah, and I think for those listening, and we're going to talk into more detail about hearing loss and what we can do for it, but if you think you're experiencing any kind of problems with hearing loss, get evaluated, because there are some options out there that can make life much, much better for you. I think a lot of people really sit and honestly suffer and try to deal with this thinking that there's not much else that they can do. when that's not the case. And for me in particular, a lot of my older patients, what studies have clearly shown is that there's a pretty good correlation between hearing loss and significant hearing loss and dementia and memory decline, cognitive decline. And so for me, that's another reason when, we're ever talking about memory issues or how can I keep my brain functioning as long as I can, first thing I ask is, do you ever have problems listening to people in a crowded restaurant? Or do you ever have to ask people to repeat themselves and so forth? Because fixing and getting that hearing loss improved can really help kind of stave away those cognitive problems and hopefully dementia.
Exactly.
So tell me, what are some newer things that you've seen in the last maybe 5 or 10 years as far as technologies and devices and things that we can do to improve hearing loss?
Well, it's an exciting time for hearing aids. A lot of advancements have taken place. One thing is the rechargeability of devices. So a lot of patients are happy to get away from having to change batteries constantly, weekly. So the rechargeability of hearing aids and Bluetooth-enabled devices as well. So you can have an app on your smartphone and you can adjust the volume or programs for your devices without having to tap or make any gestures to the device. It can be discreet. Nobody has to know that you have any hearing aids on. So those are some recent advances.
I think technology's come a long way, and correct me if I'm mistaken, but hearing aids are kind of one of the most high-tech, most researched and developed, and most money have gone into hearing aid technology than almost any other medical device out there. Is that correct?
Yes, I believe so, and rightfully so. Nobody wanted to wear, big old body aids or, it's not the hearing aid of your grandmother anymore. They're nice and small and discreet and have advanced sound processing, more noise reduction, and they've come a long way.
Yeah, I think that's one of the most beneficial things that I've had for patients who have gotten hearing aids is that noise reduction. Being able to go out into a restaurant or some kind of crowded atmosphere and being able to actually hear somebody speak to them and differentiate all the noise that's going on and being able to understand, because some people, they start regressing and they don't want to go out. They don't want to socialize anymore because they can't hear very well.
They become more isolated.
Yeah.
And so that can lead to depression. So we want to keep people engaged, and part of that with hearing loss is to use hearing aids, which will help you stay engaged. It will help you build your relationships, maintain your relationships. So very important.
Okay. So what's the process? So say, somebody's listening out there today and identifying, okay, maybe I'm having some hearing losses, or maybe their doctor recommends, hey, you need to go see an audiologist. What can our listeners expect if they go and visit you for the first time?
Okay, for the first time, you'll come in, you'll have a little bit of paperwork. I'll get a case history, see if there's any other family members who may have hearing loss, if you're suffering from any tinnitus, if you've ever had any ear surgery. So I'm going to get some background on you first before we start the testing. And once we start the testing, or before we start the testing, I'll do an otoscopic exam, make sure that your ears are not occluded with wax. If they're not occluded, if I've got a good visual of the eardrum, then I'll go ahead and proceed with the testing. And the testing involves listening to various tones, different frequencies, and responding to those tones. And then I'll make a graph or a plot of those tones that you've responded to. In addition, some speech testing. I'll give you some words, have you repeat the word, give you a score on your speech understanding, and that's pretty much the test. And after the testing, I'll go ahead and give the test results, answer any questions you have. If you are a candidate for hearing aids, we'll talk about your styles of hearing aids. If there is an insurance benefit with United Healthcare, there is a good benefit for devices. So we'll review that and we'll get the process started.
Great. And, really even from minor deficits or minor problems with hearing all the way to profound, there's some options available. Correct?
Oh, definitely. Lots of options available.
And then not only, hopefully improving quality of life and restoring some hearing, but hearing aids also can offer a little bit of protection for ongoing hearing loss as far as minimizing some noise sometimes and those loud sound exposures, if that is something that someone's prone to.
Right. Inside the hearing aids, you would have a compression feature that would compress the noise once the hearing aids pick them up.
Good. So not only getting hearing better, but also possibly preventing it from getting it worse.
Right.
So,
I do have factory
great.
workers that need hearing aids.
Great. And then how about maintenance and, wearing hearing aids? A lot of people, I guess, are the stigma behind it and the cumbersome nature of it. I mean, what can you tell from your experience about people that you fitted into hearing aids, and are they happy or are they not?
Oh, they're very happy. And, just as I said, a lot of patients are happy to be able to get away from having to change the battery so often. We've got rechargeable devices. So you wear your hearing aids all day long, and then at night you take them off and stick them in the charger. Very easy to use, very easy to maintain. You just want to avoid getting them wet. And they are so comfortable that sometimes people accidentally step in the shower with them. So if we can just avoid getting them wet, but they do come with a warranty, usually a 3-year warranty. So if that happens, it's a covered repair.
Great. Anything you expect to be coming out new, maybe in the next 5 or 10 years? Any kind of new technology or new advances you see on the horizon for hearing loss?
Well, a lot of the devices are now rechargeable, but those are usually behind the ear. We're getting more and more models of the custom in the ear that are rechargeable. So I'm excited about that.
So just a lot more comfort, ease of use,
discretion.
Ease of use.
Mm-hmm.
Okay. Well, great. So we talked about, if we understand and kind of identify signs of hearing loss, do you have any tips for people who, hearing is fine, hearing's doing okay, but how to protect your hearing going forward as we age, and, making sure that maybe this doesn't become a problem for us?
Okay. I would suggest, hearing conservation. If you have recreational exposure to noise, I have a lot of shooters or hunters, and you should probably have some noise protection in those environments. For the occupational workers, they should already be using earmuffs or hearing protection if they're in the noisy environment.
So like, heavy machinery, construction workers,
Yes.
leaf blowers. I mean, anything with a gas-powered engine typically is going to be loud enough to cause some hearing deficit, especially over
a period
a
of
long
time.
period of time.
Sometimes I see the landscapers outside and they've got no hearing protection, and I just want to pull over and give them advice. Yes.
Okay. Well, great. Well, anything else you want to talk about as far as your practice and what you're doing here in San Antonio that we haven't already discussed?
I think I will just mention I'm very popular these days. COVID and everyone having to wear a mask. It's just presenting a problem for those individuals who have hearing loss who had not done anything about it. So with the mask being a requirement in a lot of situations, they are finding that they can no longer put it off. So if you suspect you have a hearing loss, you have been on the fence about it, just get into an audiologist and get it documented. Even if it's your first time and you've noticed it for a long time, a baseline is nice to have. So if it progresses over time, we've got a comparison.
Yeah. So, again, not only trying to get things better if things are maybe not optimal, but also, like we talked about, making sure that things don't get a whole lot worse in the future, and being able to kind of nip this at the bud is something that's important. Well, fantastic. And again, we'll put into the link some information about how to reach out to your locations and phone numbers in case any of our listeners are interested in getting their hearing tested, or maybe somebody's really been struggling for a while and never really knew what to do. They can reach out to you and get some help.
And that would be great. It's a very easy process.
Well, Dr. Miller, I appreciate you coming on and talking about this, and I think it's been a great deal of information. Hopefully, we can continue to send some patients and they'll come back happy and
oh yes, definitely happy.
Right.
Thank you so much.
Thank you, and everyone have a good day.
All right, you too.
Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexas.org.